Welcome to Grief is the New Normal. I'm Dr. Heather Taylor, a licensed psychologist and grief specialist, here to help change the conversation about grief and build community and connection while we all adjust to this new normal we are living in. This podcast is for you if you are grieving or if you are supporting someone in a season of grief. I'm glad you're here. Welcome, everyone. I am thrilled with today's guest. Christine Slomski and I actually went to undergrad at Gonzaga together many years ago and had the pleasure of reconnecting earlier this year. Christine is also a counselor, and I'm going to go ahead and let you introduce a bit about yourself and your background.
Thank you for having me
and
on,
what
Heather.
you're doing
This is so great to
right
reconnect and to reconnect in this way with both of us working in the mental health field after many moons ago, running around Gonzaga. So I am a licensed professional counselor practicing in Arizona. I'm also an emotional freedom technique practitioner, and I love tapping. I incorporate quite a bit of that into my practice. I predominantly work with women, trauma, grief and loss, and I'm also certified in reproductive grief care.
Oh, I love that. When you told me that you were certified in reproductive grief care, I didn't even realize that was a new certification out. Can you tell me a little bit more about that?
Such an exquisite program that I went through. It is giving recognition to reproductive loss in a way that our culture does not, although we're getting better at it, but a way that our culture has not historically recognized. It takes us through the tasks of mourning and the stages of grief as it pertains to infertility, miscarriage, stillbirth, and also abortion. It gives us this beautiful, dignified framework to honor this experience for us, for our partner, for people around us, and help us to find meaning in it as well.
That's amazing. And what a gift to name voice to this vulnerable space around reproductive health that already has so much stigma connected to it. So that being said, so today's topic is, we're throwing an activation warning out there. We're going to be talking about abortion today and the grief that's connected there and the different ways loss shows up within that reproductive health space. Christine, do you mind sharing a bit about your journey to specializing in this reproductive
And I
grief
just want to give a
area?
thanks that you set the tone of what we're going to talk about. And just anyone listening, if this is triggering or tender for you, it is a big topic. So take it easy, take some breaths, and just know that we're going to be speaking about this with care and compassion and a lot of gentleness. How I came into specializing in this is just really working with women and having friends who have had to terminate a pregnancy for various reasons and not having a space to talk about it openly with a lot of layers of secrecy and shame or embarrassment. And it's just been a burning in my heart, to be honest with you. I'm very woman-centered in my work. And yet many women have come to me, and part of our work in doing trauma therapy, they've disclosed, gosh, I had an abortion 30 years ago, and I've told maybe you're the third person. And we can find a way that it really connects to their trauma story and some of the symptoms that they're having because they're carrying around the secret and they haven't really had the space to look at it and see, what did this mean to me? What are my feelings around this? Who were the key players involved? It was just tucked away and we just went right along with life. And when we've been able to really look at that and give it space and dignity, I've seen awesome things happen for women. Just a lightness, unloading their trauma story, physical symptoms have also cleared up. And also just with my own reproductive loss, the loss of a reproductive vision, if you will, my reproductive story I thought I would be living now. In this season of life, I'm not. And so I've had my own quiet grief that goes unacknowledged by culture. And so it's really a parallel loss that I have. So that's what's called me into this work.
Yeah, I think that's so lovely that you're able to make a space, women carrying around, it's been 30 years and you're the third person I've told. There's so much freedom there in being able to bring that disenfranchised type of loss to light because it is something we carry with us. We talk about on the podcast, grief never goes away. It just gets different. Abortion loss is just as valid as any other type of loss. It deserves to take up space just like any other type of loss. What an amazing gift you're able to give your clients by holding space for that, normalizing that language that we can have complicated feelings about this type of loss. It's not just one way. it's varied, it's layered, it's
Absolutely.
complex.
Absolutely.
And we carry it with
so
us.
nuanced. And in our culture, we have such a broad brushstroke as we discuss abortion, and that further disenfranchised the real discussion around an abortion experience and its impact on women and their partners or friends or family, however you want to look at that. And we see it under really two polarized camps. One camp here, it's a condemning thing, and over here, it's relief, no grief. And yet there's really no space for women or their partners to come, a safe space to really have that acknowledged and to process it. So you're right, it's really layered and deeply personal. We know that grief is so different for everyone. Whether you had an abortion experience and that has contributed to your life and you are resolved in that experience, but there's still sorrow, there's still emotion around that. It's okay to acknowledge that and process that. In fact, it's necessary.
Yeah. Absolutely. And I've said it on the show, you can't tame it till you name it. This needs to be named because it was life-changing. It was a deep grief experience, and our bodies remember and hold on to that, being able to have a space to process what that meant, to find meaning, and to learn how to carry it in a different way. I think that's so powerful. And you're right, especially because it is so polarized in society these days. Our intention in having this conversation, which we talked about a little bit before we started, was to make a space to normalize talking about this type of loss, to not necessarily bring in the politics or religion, but just from a grief and healthcare standpoint, this is something that needs to be talked about, and for us to validate and give tools to those walking through it.
I really wish in our mental health field, in our training programs, in our graduate school programs, that this was discussed. This is also part of me really wanting to normalize the conversation around grief and abortion. As a therapist, I have had to seek out specialized training in attuning to my clients in this space. We are not given a lot of discussion in our training programs around grief or abortion. As a field, I think that we can do a lot better as we move forward. I've had some clients and also friends come to me and say, gosh, I saw a therapist once who was subtly shaming me for my abortion and saying, gosh, you had an abortion. Of course, you'll feel all these things. I've also had a client come to me seeing a previous therapist who said, and she had mentioned her abortion, and she said, oh, no, that won't have any impact on you. And so there was even no space to acknowledge it. I share that because as therapists, I really want us to be informed about, you're right, that abortion changes you, and we've got to know how to better accompany women and men on that journey.
So in that same vein, what would you say are some of the losses that can occur as part of pregnancy termination, like that we don't often talk about or recognize?
That's a really good question. And again, it'll depend on each person and their community, their life domains, but one can be a loss of innocence, in a sense that I never thought I would be in this situation. And now I'm faced with this situation. I've made this decision. And so there's a sense of loss of, gosh, this is just an outcome I never thought I would be living. So a loss of innocence, especially if under the circumstances that you got pregnant, there was an assault or a rape, and now you are terminating that pregnancy. Obviously, a loss of innocence there as well. Sometimes there's a loss of a partnership, especially if there's conflict around the abortion decision. Depending on how people may react to you, you may lose a community, you may lose some friendships, you may lose connection to your family members even. There's a lot of different layered losses, even your a sense of identity, sense of perfectionism, right?
Sure.
It can be that. It can be many things. So those are some things that come to mind when we've terminated our pregnancy.
So we've talked about disenfranchised grief in another episode, but around sibling loss or friend loss or death by suicide, what would you say are some ways that abortion falls under that disenfranchised loss?
When I think of
umbrella?
disenfranchised loss and disenfranchised grief, I really think of Dr. Kenneth Doka's definition. It's a loss that is not socially recognized or supported. That goes back to these really polarized camps and messages in our culture. And so it's not socially recognized that this is okay to grieve. You're either right or wrong, you're good or you're bad. I think that's what contributes to this experience. Also, not knowing how people around us will accept this news if we choose to bring it to them or if we want to tell them our story, from friends to neighbors to therapists to people in our community. And so that's where I think the disenfranchisement really comes into play. And I'm also thinking of disenfranchisement as seeing this as a non-event. In a sense, a person hasn't died in the hospital. There hasn't been a car accident. Similar to miscarriage, it's still considered a non-event. And yet it's an event for us. We know that, right? But nobody can see it. And so that's, I think, what keeps us in this disenfranchised grief and loss space, where it's really hard to acknowledge the emotions and the feelings around it. Does that make sense?
Absolutely. I'm thinking about that in a similar vein, like you said, with miscarriage. There's that tangible representation, and that even goes so far with so many mental health diagnoses, right? You can't see, it's happening internally, and society can't see that. They can't touch it or relate to it. And then it doesn't exist in the same way. If I broke my arm, I'd have a cast. I can see that tangible representation. And I feel like with abortion, it's in that same intangibles. Like you're not seeing it, and it's not giving you, almost like people need that physical representation to give us permission to grieve it. And if we don't have that piece for society to see, then I have to keep it secret. It's this shameful thing, or I failed, or I've done something wrong, or like you were saying, it's that polarizing the good and the bad.
Absolutely. Exactly.
And
On.
Yeah, does that make sense?
Yeah. I love it.
I think it's so complicated. And when you have that disenfranchised piece in it, it's almost like we have to justify giving ourselves permission to mourn, to grieve it, because it can be so polarized. There's so much potential shame attached to this decision that's so deeply personal.
No, it's not simple at all. It's very nuanced. And women will terminate a pregnancy for many reasons. An unwanted pregnancy, or even a wanted pregnancy where the medical prognosis is not good. It's very life-limiting what's going on with the fetus. And that TFMR terminated for medical reasons. Some women have been in situations where they've been forced into an abortion, which is unfortunate. And working with the grief around that, the circumstances surrounding that. Someone that comes to mind is Grace Campbell, and she is, I think, a 29, 30-year-old comedian in the United Kingdom. And an article came out with her 2 months ago, so this is June 2000, about 3 months ago now. And what I loved about her article and her story, to your point, is that she really brought to light, gosh, this is a decision that I really wanted to make. There was so much that was complex around it. I actually was conflicted, but I'm glad that I made the choice. Yet nobody told me the grief and the anxiety and even the depression that would come with this. She was in this space of, gosh, I don't want to betray my fellow women, right? We have a right to our reproductive health. I don't want to betray them, but I want everyone to know, because I didn't know, that there is an intense grief that could follow. And so she took her story to stage. That was the only way that she could process her grief and her experience. I really appreciate hearing stories like that, where we can talk about, hey, this is a thing, it's complex, it's nuanced, and it's also wearing the sticky bits afterwards. So I hope that makes sense.
Oh, that absolutely made sense. Yes. They were able to find a way to make meaning from that loss that made sense for them and how they do life and process things. And I think that's one of the beautiful things about doing grief work is meaning is going to make sense for you, and it doesn't have to make sense for anyone else. What's meaningful for you is going to be different than someone else. I think that applies with abortion. Your grief is going to look different for you. I use this with my students all the time. They'll ask me, trying to get a yes or no question about what one way that it's going to be. And my answer is always, it depends. Like, to the point where one of the cohorts I worked with made stickers for their laptops that said, it depends. I think that's such an appropriate response, because there's no linear here. There's no black and white here. It's such a personal, unique choice per pregnancy, per relationship, per phase of life. We want to make it simpler than that. And it's just, that's not feasible. It's not going to be simpler just to make us more comfortable, because it's hard. It's painful having to make decisions like this.
Absolutely.
Yeah. Basically, what are some of the challenges that you see in the people you're supporting with receiving emotional and mental health support?
A few things come to mind. One is, because this is considered a non-event or a disenfranchised loss, some women or men will think, gosh, this is something that I can't grieve, or there's no need to grieve, or I'll just get past this, I'll just move through it, or even, where do I go? A lot of times it's There are no resources, at least I found there haven't been any resources in my community here in the Phoenix area for post-abortive support and in the clinical mental health field. So I've created that. On the other hand, I'm aware that churches have faith-based programs, and yet that's not for everyone as well. And so I think that's one barrier. Something else that comes to mind is I've heard from some women, gosh, this was my choice. And I feel like because it was my choice and it didn't happen just outside of me, I don't have a right to grieve this or to seek help grieving this. And that is something that we have to do some education around. And you absolutely have a right to grieve this, whatever that looks like for you. And right now in our cultural climate, with things being so polarized, I do hear from people in the community that they just want confidentiality. They don't want to reach out and put themselves back into a place to rehash an experience that they had tucked away and put in a box and set aside. They don't want to open that box again, given how things are right now.
Yeah, that makes so much sense. And also, I think grief is such a personal experience. And with something that already makes us feel so vulnerable, it can feel daunting or overwhelming letting other voices and feedback in. And because this topic can be so polarizing, letting more voice in when it's like I'm at peace with my decision, I'm still grieving it, and yet I know I made the right choice for me. I don't necessarily want other feedback that's maybe harmful or minimizing
that does make sense.
Or shaming.
And here's the thing. And sometimes I'm in conflict with this right along with my clients, because grief can be incredibly effective in healing when it's communal, when we're connected with others, right? Yeah. And I've seen that absolutely. In a room full of women who have shared in a pregnancy termination under different circumstances. They can look into each other's eyes and just say, oh my gosh, I get it. I understand. And yet this is such a deeply personal and nuanced experience that it can be very daunting to be in the presence of others and open yourself up to, gosh, how will someone see me or perceive me? What will they say? And sometimes it can feel so much safer to just keep this within or find an online program that can walk you through a grief work. And there are some, but yeah, sometimes it's a little bit in conflict.
Sure. Yeah. And I love that you were able to make a space with some women that you worked with who had pregnancy terminations. And it's like they were speaking the same language. I see that struggle that you went through, and I relate to that in a way that's unique to me, but also shared in some ways with you. And that can help with normalizing and making it less daunting to share. So I think that importance of being intentional with who we invite into those sacred spaces with us that aren't going to try to fix or rescue or make it about them, but can just show up and be in those complicated feelings with us, whether that's a therapist, a safe friend, a support group. I think learning how to be intentional with who we invite
absolutely.
into
and it reminds me
those
of
vulnerable
Brené
spaces is
Brown's
important.
Work when she would talk about vulnerability and that others have to earn the right to really hold our story and care for that story.
You mentioning Brené Brown, that just makes me think of the language about getting in the arena with others. And I think this is one of those spaces where we need to be getting in the arena with our community that is grieving these abortions and just showing up and being there with them. Because again, it's not something we need to fix or rescue. It's just showing up in solidarity and validating that you made the best choice you could at the time with the tools and resources you had. And it's okay to still grieve.
In fact,
that
it's
choice.
necessary. Because what we don't grieve, it just stays with us. It will grow bigger and heavier over time, left unattended. I do a lot of mind-body work, so I'm very integrative in like clinical work. We know that the body stores our secrets, the stories of our life, our trauma. If we are not tending to that grief, it will manifest in the body and express itself in some way down the line. And I've seen that happen time and time again with all kinds of things, but also with a pregnancy termination that's not tended to. And that grieving journey can be short, it can be long. And to your point, it's so personal and it's yours. And no therapist, no friend, nobody can tell you what that looks like or what it should look like.
Yes. In that space of self-care, when you're feeling vulnerable and grieving in that pre-post abortion transitional space, what are some helpful self-care things to consider?
Self-care is so personal to everyone. I would say surround yourself with safe others. Take time for true rest, true self-nourishment. And nourishment can be anything from just slowing down, cooking a good meal, getting out your essential oils and smelling them. I know I'm a very sensory person. It's writing things down and journaling, moving things out of your mind onto paper, movement, caring for yourself with kid gloves, whatever that is. Staying in bed for 2 days, that's okay too, if that's what you need. But something that feels nourishing, calming, and comforting.
We're wanting to invite safe people into that grieving space with us. What would you say are some helpful things our partners or safe people to know to help us feel validated, good things to say or not say?
I think getting ahead of that by alerting your people to maybe that you just need someone to sit with in the silence. Or maybe it's, hey, would you be willing to answer the phone if I call you or text you late at night for the next couple of weeks? Would you be willing to just be with me on the phone? Could I come over after work? It could also look like, just making the request for someone to be on alert that you may need them in a different way over the next couple of weeks or months. So that's what comes to mind. And individuals who give the platitudes, they're always well-meaning. I've had people offer that to me in the past few months with my own losses. And as much as I want to tell them, hey, that's not helpful, in some situations that will break the connection between both of us, I can just hold in my heart. I know they're doing the best that they can. Where I can educate them, I will.
Very diplomatically put. Yeah, the platitudes are tricky. And sometimes that is what people have the capacity for. And that's hard. Because again, we're in a very grief-phobic, grief-illiterate society. And so a lot of people, they want to say something and they don't know what to say.
It really reveals their own uncertainty or discomfort with the situation, or just not being prepared with knowing how to handle your story or your emotions. And it's not ill meaning in any way. And being able to see that people are really wanting to be helpful. They just don't know how, or they're not skilled or equipped.
Absolutely. What would you recommend to the person who's wanting to talk about their abortion, but is afraid to, or doesn't know how to bring it up?
What comes to mind first is really, and I understand that writing and journaling is not for everyone. I get some pushback from that from some of my clients, but really finding a way though to type it out, write it out, but first to start to tell your story with yourself. I think that can be really helpful and effective. There's some online tools for that. But being able to process it and put language to that experience and make it linear for yourself. Sometimes we can't remember. What I'll hear commonly from my clients, they can't recall all the details of their abortion experiences. Being able to start with yourself and writing it out, that can be helpful. Searching your network for someone who could be a safe, literally write on a piece of paper, the people closest to you. And that can be a really clarifying experience. Who do I know and who would be safe? And then you can reach out, text them, call them. There's also yourabortionexperience.com. It's an online, it's not really a program, but it's an outlet where you can type in your experience. It's confidential, but that's something I have found helpful, that someone could just pull up in the middle of the night and type their story. I would also see if you could find a therapist who is informed about the impact of abortion and the grief journey that comes with that.
Absolutely. Not everyone has safe community members or safe people, and that can double down on those feelings of isolation that come up when we're grieving, especially if we're feeling that disenfranchised grief aspect of an abortion. So find a therapist who is trauma informed or educated in reproductive health and use that as a safe space. There is something powerful about externalizing what's going on in our head and putting it onto paper. There's research studies on the healing power of that. I talk with my clients all the time. It's almost like when we've had something grief related come up, we don't want to forget the details. And it's like an old school record playing on our heads over and over again. And we have to find a way to lift the needle off so we can flip it to the B side or change the records out. And by putting the words to paper, it helps disrupt that, because then we're not worried about forgetting a detail or something nuanced about that memory. And once it's on the paper, it's okay, brain, you can calm down. all of the information is on the paper. I don't have to
So
keep it
good.
spinning.
I love that analogy of the record player. Yes. We also know that research shows, because they've done research around what happens in the brain. We have that tactile processing, right? We pick up the pen or pencil to paper, what's happening between the brain and that whole communication pathway, putting it on paper, the benefits to that. Writing is great. And you don't even have to be a good writer. That's not what it's about. It's not about Dear Journal. This is what it's just getting it out.
No, absolutely. And like some of my clients, when it's been a traumatic loss, will do a timeline. And so they just will bullet point out the different things that happen. And then they'll go back through and what did I feel on each of those moments in the progression of events. And even that can be helpful. So again, it's not like you're having to wax poetic about your experience, just getting the pen to paper and helping release
and
some
I
of the
love that.
pressure in
That
your
would
head
even be
is
fabulously
really helpful.
applicable to a termination experience. What led up to this? What happened during, and then what happened after? And what were my feelings around that? Yeah, that's a great way of processing and emoting.
So, as we start to wrap up this conversation, what would be 2 or 3 important takeaways to really understand about the relationship between abortion and grief?
Your grief is your own, your experience is your own. Your experience with abortion, with terminating a pregnancy, is yours and yours alone. And it's okay, and it matters. However you feel following that experience or around that experience, it's not right or wrong. It's yours. And you have a right to grieve that however you want to share that. I think that's important to remember. What comes to mind is that the feelings of grief or sadness, or the whole spectrum of emotion, it's really normal because this is a disruption in our reproductive story. Dr. Jaffe out of San Diego, who is at the Center for Reproductive Psychology, she talks about we all have this reproductive vision for ourselves. Whether or not we want children, it's still a vision of how we think our lives are going to go. And so many of us, we don't foresee that we'll be in a situation where we are having to choose to terminate a pregnancy. It's not something that we seek out intentionally. It's been a surprise. And so knowing that we carry this unconscious reproductive story or reproductive vision, and that abortion has fractured that, it's put a fracture in that vision, that's okay. So then we're going to be grieving that. We're going to be adjusting to what's called like a new normal, this new reality. How do we find acceptance in that? How do we make meaning out of that? Those are 2 takeaways that come to mind. And then the third is just such deep and rich self-care, really caring for yourself throughout this experience, whether that's through books or poetry or journaling or seeking out a support group for pregnancy termination, seeking out a therapist who understands reproductive loss. That's really key as well.
I love you bringing in the spectrum of emotion. I think that's such an important piece, and the disruption in how you thought things were going to go. I think grief is this, or can be this big disruptor in general. We're on this one path and we didn't see that a fork was coming, and then suddenly we're on a different track. I was on this one. This is how I thought it was going to go. This is where I thought it was going to get me. And now I'm over here, and that's really complicated. And I think that is just as applicable with terminating a pregnancy. You didn't think that this is the path that you were going to be on, and yet here you are. How do I adjust to that new normal? Figure out what it means to be here, and how do I keep moving forward in a way that's meaningful for me and honoring the grief that I'm going to carry with me.
The grief, particularly with terminating a pregnancy, will change over time, just like grief in every other life domain. But the grief will be different from when we are in our 20s to when we're in our 40s to when we're in our 60s. We'll be looking at that experience differently. We'll be reflecting on life and our path differently. That termination will change form over time, as long as we are acknowledging it and attuning to it in healthy ways.
I think we packed a lot into this conversation in a really good way. I think this was a great starting conversation, and maybe we'll have you back and we can flesh out that next level and maybe some more of the nuance around pregnancy termination and the grief there. Because I think, like you said, it is so multifaceted and nuanced to each person. Christine, you are a very busy clinician with some really impactful projects going on. Do you mind talking about some of your projects and how people can connect with you?
So I've got a couple things going on. And one is in my local community, I volunteer in grief retreats for women, men, couples who are making sense of their lives after a termination experience. And that is something that I love to do. And then in my clinical work, I have started the first and only clinical offering in the Phoenix area. It's called the Healing Circle. It is a group for women after an abortion experience, whether that was a recent termination or if it was literally 40 years ago. All women are welcome to come and to explore what their experience has been like, what their grief has been like, how their abortion has changed their lives in some manner. And so it's really to bring women out of isolation, out of that disenfranchisement, and franchise them, right? Bring them together and let them know that they're not alone. And that's really where my heart is. If we were to sum up today's discussion, I want women to know they are not alone and that there is compassion for them and understanding.
Amazing.
And you can find me at christineslomski.com.
Christine, thank you again so much for this great conversation and the work that you're doing. It's such a gift to your community, and I look forward to collaborating with you more in the future.
Likewise, Heather. Likewise.
You're
Thank
amazing.
you so much for having me. And I just have the biggest smile in my heart because we knew each other so many years ago in undergrad, and here we are.
So many years ago, and here we are, real professionals and everything. Listeners, remember to be kind to yourselves today, and thank you for tuning in, and we'll see you next time. Take care. That's all for today's episode of Grief is the New Normal. If today's conversation resonated with you, I invite you to share it with someone who might need it. And if you're looking for more support or resources, feel free to head over to The Morning Movement, where we continue to build community and normalize these hard, beautiful parts of life. I'm Dr. Heather Taylor, and until next time, be kind to yourself. Opening and closing music is provided by the Datacorns. If you're interested in being a guest on the podcast, collaboration, or training opportunities, feel free to email me at hello@griefisthenewnormal.com. And podcasts are also now available streaming on YouTube.